Hello, it's Dr. DeBord, and I'm here to talk about Chapter 16 and therapy and treatment. I'm going to try my hardest to pull this together in a brief format, but because this is my special topic of interest, and as a therapist, it's really hard to stop talking about this stuff. So I will see if I can condense this for you in a way that's meaningful. Um, if you look at some of the research from your book, and I will try to direct your attention to aspects of the book which you may see test questions on, there are a number of graphs pictured there that indicate how frequently people have been seeking mental health services. This has been a while ago. This is, from about 17 to 13 years ago. But the percentage of adults who received mental health treatment from 2004 to 2008 was increased a little bit. And then just more recently, about 4 years ago, it was 14.8%. So given the numbers that we've talked about in previous sections on stress, it's surprising that this is such a low number. I would be curious to see if these numbers have changed during 2020, given how emotionally stressful the year was. And just as a reminder of that, here are a few data on some data that were collected from April to June in 2020, and indicated that 40% of adults said they had at least one mental disorder or mental health condition, including anxiety or depression, during that time period, 40%. And included anxiety, depression, trauma. Substance abuse increased by 13% for the overall adult population. That's a huge number there. And then suicidal ideation for traditional college age students was in the, like, if they said they had suicidal ideation in the past month, was 1 in 4. So I would be surprised if the numbers of people who seek or have been seeking mental health services has increased in the past year. I'd be very surprised. As a therapist, I've gotten so many calls to take on new clients that I've not been able to do because obviously I teach full time. But I can say just from my own personal experience, I've seen an increase in demand. Kids seem to get a little bit more of attention. I'm guessing that's because parents, and also you have the educational system involved, saying like, this child needs services. So from ages 8 to 15, you get closer to half of those kids with some sort of mental health issue or receiving treatment as recently as 2017. Why do so few seek treatment? That's a question I want you to think about. And if you're in my in-person class, we'll discuss that at length. If you look at some of the history, I know I've referred to some of this in the psych disorders section. They used to treat people, and historically, people with psychological disorders were treated poorly, as if they were possessed by demons. And so they had methods for treatment that included trying to drill holes in the skull, like you see in this picture here, called trephination. And that was to allow an escape hatch for evil forces and demons. And they were just, mental illnesses were not well understood. And they thought it was like bad blood, so they would bleed people, they would castrate people so they wouldn't have kids, all sorts of problems. If you look at the history of the treatment of the mentally ill, it wasn't until late 1700s that in Western society, it was like, how about we, instead of locking people, because people like in France at that time were, who were hearing voices other people couldn't hear, they were being like jailed, basically. And in being jailed, they would be chained to the walls and, given straw bale to sleep on and bread and water, basically. And this guy came along in France and said, hey, how about you let me unchain them? I'll take them outside a couple times a day, and they can toss a ball back and forth and see if that helps their condition. The local government said, if you do that and they cause problems, we're taking your head off, because that's when the guillotine was popular. He said, I'll take that chance, and they improved. And so, inspired by those sorts of reforms that were starting to happen in Western Europe in the treatment of the mentally ill, and there's history of like how popular asylums were throughout all of the world, in If you take my psych disorders class, it'll talk about that. It was a woman in the US who, once they finished the Transcontinental Railroad, got on that thing and went state to state petitioning state legislators, saying, let's take these horrible things that we have where we're housing people and take people with mental illness to the country where we can build new facilities and they can be outside and they can be in the countryside and it'll help their mental health. Also, and historically, if you look at how our understanding of mental illness shifted, it started to be understood that a common sexually transmitted infection, syphilis, was responsible for all sorts of dementia-like symptoms. And so it kind of changed how we saw mental illness as not just being a bad character or being possessed, but like, oh, maybe there's a physical basis for all this. So that started to show, we started to see the medical model take hold in how we were going to treat, the human beings were going to treat other people that were perceived as having disorders. In the US in the 1940s, mental health hospitals housed over 400,000, I mean, close to over 500,000 at one point. And in the history of treatment of people with mental illnesses, it's usually like, oh, we should reform, we should do better. And then like an economic crisis hits the country, and then all the funding for mental illness goes down because people with mental illness have a hard time advocating for themselves. I have a link here to a video which talks about basically the history of the treatment of mentally ill. If you look at I put it down here, the 1950s, 1990s, mental health patients declined from over 500,000 to 100,000. This is a process called deinstitutionalization. It was with the advent or invention of antipsychotic medication, Thorazine, that you had practitioners say, we can't afford to house all these people, keep them in beds and feed them and all that. Let's just give them these meds, these bottles of pills, and then they can go find jobs. Problem was there was not good follow-up with the community mental health centers that were supposed to do the follow-up. You had caseworkers that were overloaded. Sometimes they have 200 patients on their caseload. You can't track people. If you got, even you have a handful of people with schizophrenia, trying to keep track of them and make sure they have jobs and they have housing is really difficult. Now, I mean, the U.S., I mean, it's pretty bad. You look at how we treat people with mental illness. It's often prison. People with mental illness will be arrested for petty crimes, maybe petty theft, whatever. And then because they can't follow the rules in prison and because they have paranoia and serious mental illness, they will go deeper and deeper in the system and have a hard time getting out. This is the graph I was telling you about in terms of deinstitutionalizations, when they created medications and then just started releasing people en masse. Psychotherapy, basically, shifting gears, is what I do in addition to teaching. And I like your book's definition. Help a person stop repeating and acting destructive patterns and start looking for better ways to deal with difficult situations. I think that's the primary goal of psychotherapy. Typically, I will really ask my clients to put it in their own terms. How would you state your own goals for what you want to look like when this is over? How are we going to know when this is over if you're doing therapy with me? And I'll keep going back to that because I don't want to charge a person money if they're not seeing themselves making progress or the goals that they state themselves. There are two major types of therapy. The one I'm good with is talk therapy, psychotherapy, and there's biomedical. Your book talks a fair amount. I wrote a number of test questions on biomedical therapy. You'll be expected to know that and read that from your book. But in this lecture and the next one I'm going to post, I talk about psychotherapy. The major forms are listed here. They're described in your book. I will not be talking about play therapy, and I usually combine a little bit about behavior therapy and cognitive behavioral therapy. The one that I will talk about in this particular recording is psychodynamic, and that is Freud's model. And he was the first psychotherapist in Western Europe. 1800s, he was a medical doctor, but people were coming to him with problems that he could not explain medically. As he got the people to talk, he realized that they would have a release of pent-up emotion and start to kind of recall what he considered to be repressed or shoved down memories in their unconscious. And in recalling those memories, they would have relief from the symptoms that they described. And he's like, you have these two forces which motivate human behavior. One is for pleasure and life, and the other is for destruction and death. He called those eros and thanatos. And it's this constant tension there between these two. He said the goal of most human behavior is to reach a tensionless state. If you think about that, ultimately results in death. There were two models he had in describing human personality. I'm going to show you on the next picture how those are mapped out. Topographic, if you've ever seen a topographic map of an area, it has like mountains and valleys and rivers, and it tells you where the highs and lows are. That's kind of the way he thought about consciousness, that we have the tip of the iceberg is the stuff that's at the top that we are very fully aware of. And then you go a layer deeper, right at the water level, where it's like, okay, you may not be thinking about something, but if I ask you to think of a friend you had in third grade, you could probably do that. So that material would be like the pre-conscious, right? Under the surface, easily accessible. But the unconscious, now that takes work. But that's where most of our problems reside, that we, according to Freud, repress our unresolved conflicts into that unconscious. And it takes therapy to help pull those out. He also said that we had three major forms of personality, which I'd like you to know about. One was this is how we're all born, this kind of pleasure-seeking id. But because we can't immediately have all our needs gratified by any parent figure, we have to come up with ways to plan for delays in getting our needs gratified. And that creates our personality, what she called ego. And ego is basically works on the reality principle. It says like, okay, I can't have everything I want this moment, even though my id wants this. So how can I soothe myself? What can I tell myself? What can I just wait? As we grow older and go through stages of development, Freud would argue that we are able to identify with our parents more, and we develop another piece of the personality from society and our family. It's called the superego, and then basically that's our conscience. That's what tells us what's right and wrong and gives us our role models for how we want to behave. This is that map I was telling you about, that most of the id is, all the id's unconscious, that you have the ego there kind of dealing with all levels of consciousness, and superego also dealing with all. Okay, so the soul of psychodynamic therapy, the goal of it, is to make the conscious, unconscious conflicts conscious. And that once you become aware of these things, then you have a catharsis, which is a release, a freeing of fixated, just caught up energy. So kind of like it's been plugged up in your unconscious, and it comes out, and then you have more choices, you have more freedom, you have more energy. So that comes with insight into these conflicts. These are the major tools here, and this is the bulk of psychodynamic therapy, or Freudian therapy. He would often argue that our dreams are the roadmap to the unconscious. And so he would do a lot of dream analysis in his therapy, that he could use those symbols to help understand what unconscious conflicts a person had within their psyche. A slip of the tongue is when you accidentally say something that you say, oh, I didn't mean that. But according to Freud, that was a sign that, oh, there's something related to that you're repressing or pushing into your unconscious. Repression is the primary defense mechanism he identified, and that is pushing anxiety-laden experiences and conflicts into our unconscious. Free association is the key for him. He went from hypnosis to free association. And this is, imagine if a therapist would ask you to do this. This is not the kind of therapy I do with my clients, but like therapists ask you to like just lay back, and this is the traditional seeing someone lay back on a couch, and then take off all filters and be willing to say out loud any thought, any feeling, any image that comes to your awareness without filtering them all. And they don't have to be related. It's just stream of consciousness. And you just start vomiting out everything that comes to your awareness. And the therapist writes it all down and then looks for patterns. Their main tool then is to provide interpretation of patterns that they see from your dream content, from your free association, from all sorts of things like that. The projective techniques, I mean, you've probably seen the Rorschach ink blot test. That's what I have right here. Is they put an ink blot, and then they divide it, smash it in half and open it back up, and then ask, what do you see there? And the idea, calling it projective, is the idea is that we project our unconscious conflicts onto those images. And again, allowing the therapist to interpret the content of what we say that we see there. Transference is pretty big too. That basically what's going to happen is that as we grow up as kids, we start developing these like really intense bonds with parents and family and other people. Um, but they're fraught with problems. I mean, there's conflicts within those relationships too, and there's all sorts of, I mean, the guilt that comes in a way, the unresolved anger. There's sometimes trauma and abuse. Um, what happens, according to Freud, is that we take these early patterns of relating to other people, and then as we grow older, adolescence into adulthood, we transfer those same expectations onto other people. And that's what transference is about. And Freud argued this would happen in the therapy relationship too. The clients would transfer their feelings from significant relationships to the therapist. And that's up to the therapist to catch that, be aware of it, interpret it, and saying, are you aware that you're basically expecting me to betray you, that you're expecting me to blank, blank, whatever it is. And then have the client like realize, oh, this is part of their pattern of expectations in relationships with other people. So I believe we're going to end there. Yeah, this has been about a 16-minute video. I hope this helped with the beginning of the chapter. The next video will complete chapter 16. Thanks.